Dr. JP, would you talk about the process of becoming a patient of yours and working in your center, Whole Health Solutions, and also relationship to insurance?
Most people, as soon as they come into our clinic, notice it's very different. Our goal is to help people heal naturally as much as possible. So we have a decreased emphasis on that sort of cold, clinical kind of style. We try to be very high tech as well as very high touch. And there's a few things to really think about that are different than what you expect from doctors that most people go to. So the first thing is our process is, for most people, we're dealing with chronic diseases. We don't take care of acute things. So if you sprain your ankle, or you have a nosebleed, or you're having an acute infection of some sort, please go to your regular doctor about those things, because our goal is to help you stay healthy over the long term. And to do that, it's not going to be just show up at the doctor's office when you have a pain or something seems wrong. It's more of a commitment to actually doing different steps to getting yourself healthy. And that may involve special kinds of lab tests and things so that we know exactly what we're doing. So we start off that process by really getting to know you as a person. What is it that's important to you? What is your health philosophy? How do you want to have your body treated? How do you want to treat your body? What do you expect from your healthcare provider? How do you want to communicate? Because communication, like in most relationships, is really, really important. So you want to feel comfortable enough that you can share anything with us. And that means if you didn't do a treatment, or you don't like the idea of taking a certain drug or a certain herb or anything like that, you have to be able to tell us that, because we can't respect your desires unless you're willing to do that.
One thing I think of is in homeopathy, some people, for religious reasons or others, don't want to have any alcohol. So that would be an example. There's some treatments with alcohol and without.
Right.
You need that communication so that you can customize a treatment plan that works. But the other thing, as I said for years, knowing you, I've known you for a very long time, but I said, look, until I'm really ready to either to move and act on these things, because there's some real work involved to do this. This is, you got to dedicate some time, and I was really not ready to step up to the plate. There were so many challenges going on, and I knew it. So it's kind of like you have to know how to balance the checkbook, and you have to be at the place you're ready to seriously dedicate the time to do it. And I think that's real important in your practice. And then you've got lots of support to work with them on.
That's exactly how it works. And so when you're committed, we are there to help you every step of the way, to help you figure out how to do that. We actually have a health coach in our practice who can really guide you on a lot of details, because a lot of this is lifestyle based. So we will give you the information to make the right dietary changes, how to work with other issues like sleep issues, how to do stress management. And so those kinds of things require commitment. Our practice is not, here, take this prescription for 10 days and we won't see you again. So we want to do an intervention, whatever it is we all decide that we want to do, and then we have to monitor. We have to see, is that getting you the results that you want? If it's not, we need a course correction, and we will revise what we're doing. Fortunately, we have a lot of different tools in our black bag, and so if one thing doesn't work, then we often have workarounds or other alternatives that we can do for that. One of the things that I do recommend on our website, when you click on the About tab, there's a section called Treating Root Causes. And I really recommend that people take a look at that so that they understand that we are not trying to cover up symptoms. We are trying to treat root causes so that you don't have that problem going on in your body anymore. And that's really different than a lot of doctors that most people have visited. So that's a good place to start to understand what we call the functional medicine or integrative medicine philosophy, is treating root causes rather than Band-Aids to cover up symptoms. I also recommend that prior to even filling out the detailed history that we use to get to know you, that you gather any supplements or medications that you are already taking together first, because we really need that detailed information. It makes a difference what you're already trying, either because you're required to continue to take that medicine for whatever reason, or because you've tried a bunch of things that haven't worked yet, and I like to know what didn't work. And so that can be very helpful. So going through the details of what you've already done. If you've already had lab work of any sort, anything that you've had done in the last year, or even things prior to that, bring that to your first appointment, even if whatever other doctor who did the lab work told you that it was normal. Because one of the things that we use in functional medicine are special laboratory values. So instead of just looking at the normal range on the printed report, we are looking at what are called optimal laboratory ranges, which are determined by, for instance, looking at marathon runners or Olympic athletes. What are their numbers? Because that's what you would like to be. And so we can take those same labs that you've already had done and often get many clues out of that. One of the things people ask us a lot about is, do we take insurance? And I understand that that is a very important question for many people. So the short answer is no, we don't process insurance. We do give you the pieces of paper that you need to file for insurance reimbursement with the correct codes on it and so forth, so that you can get insurance if you have out-of-network benefits. So that's your key, is to look at your policy and determine if you have out-of-network benefits, because not all policies do. If you have out-of-network benefits, you also want to see what your deductible is. So the deductible means how much the insurance company expects you to pay before anything that they do kick in. And often those are different for in-network doctors versus out-of-network doctors. So we are an out-of-network doctor. That's the phrase to use. And if you are taking Medicare, I can just tell you up front that we have opted out of Medicare. So we cannot submit anything to Medicare for you, and we actually have to ask you not to submit anything to Medicare for us, because that's actually considered illegal and they'll throw me in jail. So
we don't want to do that.
We don't want to do that.
That's very important to understand, to make sure this is the right place. And you provide a lot of education if it's not right for people right now to start with it. That's part of our channel, is to build up, that they make sure they're in the right place to come to you. I want to take a moment and just map out the whole process so that they might see your video or hear from you or someone recommends them. And often one of the more important things is people that have gotten healthier recommended they come to you. Or they've really changed their life on it, recommended. A lot of your work, I know, is recommendation and referral based. So they get that. Then they're going to reach out to the office to find out. And then there'll be forms. And I would tell people more information than they're often accustomed to.
Yes.
Because since you're looking at root cause, they need to know there's going to be a bigger hit up front in efforts to fill out data. And that's because of your using all that. You know, it's kind of like, well, is your nose running? Do you have a cough? Well, if I'm only treating symptoms, I only need a little bit of data. But if I'm looking at root cause, that's it. So I think the important aspect is there will be more paperwork to get going. And your staff's willing to answer questions on you if needed. So that's one. Then from there, they usually will get the first appointment. Talk a little bit about that.
So our first appointment is really going very much in depth to what is going on with you. And to your point, Martin, sometimes people aren't used to thinking in terms of root causes, and they don't recognize that their symptom actually is a big clue to us as to where that is. So for instance, if you come in with digestive complaints, but you're also having a runny nose or eczema on your skin, those are really good clues that something is disordered in what is called the microbiome, which is the flora that lives in the gut. or it could be food sensitivities. We also bring in things like acupuncture meridians. So in Chinese medicine, the large intestine meridian ends on either side of the nose. So even if you don't have any digestive complaints, but you're having something going on here, it's a good bet that the actual root cause is actually in your gut. So that would be how we use all this information that we're asking you about. We also want to look at, for instance, how stress affects the body. So we all know a lot about mental emotional stress, and sometimes that's not avoidable in our modern world. But a lot of people aren't understanding that that mental emotional stress has a really big physical impact, and it really affects many diseases and makes us vulnerable to many diseases. So if you can think back to when you first got sick, what was going on in your life? Had you changed jobs? Was there a death in the family? Did you have another illness right before that led to, and you didn't connect those two things? So we put all of that together in also trying to get clues as to what is actually going on.
And then from there, after the session, again, you mentioned also some of the tests are more extensive because you're not looking for I call it the bell curve of average wellness. You're looking for optimum health. So they need to understand there will be different tests than they might be accustomed to as well to work with you to get this lifestyle process occurring. And the other thing one of the things I like you said, is it doesn't look like your normal medical facility there. It is really all about the experience of healing from the moment they come in the door if they're ready to go to it. And I think this is the tough thing. Of course I'm ready to get well. Well, the truth is there are times I was not ready to do what it would take to correct my challenges. And I was smart enough to know it. So I think that's the key thing to understand with your practice. Where's the best way for them to make the first step? What do you recommend? Go to the website you mentioned, read what's there, see if it's a good match for you, watch some of the other videos. What else?
And then you can just call us. We also offer an orientation for free, where you can actually come to the office, meet us, learn more detail about how we actually work. And I really encourage everyone to come to those orientations. Even if you've already decided that you want to be a patient, even if you already have an appointment, come to the orientation first, because you'll hear the concepts, and then when we actually tailor them and fit them to you into the visit, then you're going to that'll be the second time you hear it, and so it's a little bit easier to understand what needs to be done. And we are having everyone meet with our health coach at the end of the first visit so that she can wrap up the visit and go over again with the things that we're doing. Because typically on the first visit, we'll spend a lot of time listening to you, to your story, and then we will determine what lab tests are going to help us get closer to those root causes. Many of these are done by specialty companies, so it's not necessarily done by LabCorp or Quest. We do try to tell you up front if insurance will cooperate with that and what you should be expecting to pay for those and so forth. And that's an important point for us to start to think about, is that you are making an investment in your health. A lot of people think that healthcare costs are an expense, and that's an unpleasant fact of life. However, it's real, and if you can reframe your mindset to understanding that you are making an investment not only in feeling good, but often avoiding other diseases, slowing down the aging process, staying active and able to participate with your family and your job and the things that you really want to do for your life for a longer period of time, that really makes it a worthwhile investment of both your time and your money.
Excellent. Well, thanks very much. And now you know something more about Whole Health Solutions and working with Dr. JP and her team. Reach out, see if it's the right match for you, and thanks for taking the time to watch this.